The mental health measure came in the envy of Europe. It's fantastic, but actually what difference is it making? Because that's the important thing. As Katie was saying, we can have all the legislation in the world, all the strategy, all the policy, everything in place, but actually what does it mean to real people, people like you, people like me? And our interest around advocacy is around getting that voice for people who are at a very scary time in their lives. I don't know how many of you have experienced an inpatient unit, either as a patient, as a carer, as a visitor, as part of your work. But they can be pretty scary places to be. And if you are a patient for the first time and you just don't know what's going on, it's great that we've got earlier intervention and earlier access, but sometimes you need somebody to support you to have your voice heard. And that's why the advocacy part is so important. The intention of the measure is that if you're in hospital as a voluntary patient, you're not detained, that if you need help to articulate what your needs are, you can have access to an independent mental health advocate. So it's broadening that requirement. And that's fantastic, because it means that you can have help to give your voice to say what you think and what help you need. But what we wanted to do is we wanted to work out actually what's happening for people using advocacy services. So why is it important to have somebody there that can help you to articulate your voice? Well, if it's your dad, or it's your mum, or it's your sister, or it's your daughter, you want the best for them. Now, I'm very fortunate in as much as I come from quite an articulate family, and we're able to articulate our views. And if I can't say what I need to say, then I can ring my sister, and she can help me to say it. Or my dad can help me, or I can help my sister, and I've helped her with her children in terms of education and special needs input. And that's great. We're a family that can help each other, but not everybody's got that. Not everybody's got somebody who is able to voice it. But not only that, I come from, as I say, from an articulate family. I'm also very lucky because my mum, bless her, used to work in mental health. So I also had somebody that had a bit of specialist knowledge. But how many other people have got that? You find it out as you go along, and it's just not good enough to just finding your way in the dark on your own. So that's why it's important to have somebody there to help you articulate what you want to say. So why us? Mind Cymru, we're not direct service providers, so why us? Well, I think it's important that we've got a national and local presence. We understand Wales. We work closely with Welsh Government in legislation when it's being built, when policy is being built, using our network of local minds to get the voice of people heard at that national level. And also Mind, every year, Mind across England and Wales gives access to advocacy to 21,000 people. So Mind knows a little bit about advocacy. So that's why we think it's important that we're doing this work. So how have we been going about it? Well, the way that we've been going about looking at our advocacy study, and Julian's going to talk about the process in a moment, is really about putting the person at the centre. That whatever you do, it's really important that the individual and the needs of that individual are at the very heart of the way that it's been done. So we've built the survey around that, working in partnership and using the expertise that we have, and listening to what people told us a year ago. We did a baseline survey about a year ago, and we've learned from that. That was mostly an online survey, and we've learned a lot from that experience.